Welcome! Let's talk about how to manage pain at home following joint replacement surgery. The nurse will go over specific instructions before you leave the hospital, and general information is in the handbook. It is important to understand feeling pain is normal and part of the healing process. So expect pain, especially during the first few weeks after surgery. Remember, surgery pain is temporary and will get better as you heal. Don't wait for pain levels to escalate. Find ways to relieve the pain when it starts to feel worse. Taking prescription narcotics will probably be necessary around the clock for a few days, with the goal of eliminating within a week or two after surgery. Don't go cold turkey. Gradually decrease the amount and how often prescriptions are taken over a few days. Either progressively increase the time in between doses by an hour or two, cut pills in half, or substitute with Tylenol, otherwise known as acetaminophen, for pain. Gradually decreasing before stopping completely will prevent complications related to dependency. For most patients, the hospital prescription will be enough. If a refill is necessary, plan ahead and call at least 2 days before more medication is needed. Remember to limit the total amount of Tylenol to 3,000 milligrams a day to avoid liver damage. Some narcotics contain Tylenol, so be sure to read the label and include that number in the total amount given. All medications have the potential for side effects, including dizziness, nausea, and constipation, which is the most common side effect. We recommend Miralax or Milk of Magnesia to soften stools while on prescription pain medication. Be sure to have one of these over-the-counter laxatives at home and take it every day until bowel movements are normal. Call the surgeon's office if it's been longer than 3 days between bowel movements. Even though decreased appetite is common during the first few weeks after surgery, a good diet and drinking plenty of water is essential. All pain meds should be taken with food or milk, especially during the night. Increasing the amount of fiber and fluids helps keep digestion moving. For an extra dose of fiber, check out the easy recipe in the handbook for BAP, bran, applesauce, and prune juice. Here's a tip. Freeze BAP in an ice cube tray. 1 cube equals 1 serving size. Medication is just one part of pain management. Other techniques are recommended. Try deep breathing through the pain. Avoid thinking about it by watching TV, reading a book, or playing board games. Distractions are helpful, and so is changing positions. Readjust while seated or lying down to avoid stiffness that leads to pain. Remember, for a new knee, never put a pillow under the bend of the leg. You might notice some swelling around the new joint, and that's normal. Take home the hospital gel packs found in the freezer to use with the wrap. And remember the acronym RICE. R is for rest to control swelling and pain associated with overdoing activity. Other than exercises and walks recommended by your doctor, you should be resting. For swelling, remember I. For ice, apply ice using 2 of the frozen gel packs for the first 2 to 4 weeks. Keep the other 2 gel packs in the freezer so they're always ready to go, and switch them out every 3 to 4 hours. You can machine wash and air dry the wraps. C is for compression. Wrapping the gel pack snugly helps with swelling. And E is elevate the joint. For those with a new hip, you may place pillows under the foot or leg if there's swelling. For a new knee, put the wedge under the entire leg to keep the replacement knee straight. Use as often as tolerated for the first 2 weeks. Keep the guide to recovery in a handy location and refer to it often. Always call the surgeon first with any questions or concern related to joint replacement. Remember, the surgeon is your partner in care. Don't hesitate to call. When you call, the surgeon may recommend a visit to an orthopedic urgent care location, which is preferred over the ER because it is less expensive and limits exposure to germs. If an ER visit is necessary, don't forget to take the joint replacement card with you. If the situation is life-threatening, call 911. Please watch the other joint replacement videos for additional information. Recovery is a process. Be engaged and take care of yourself every step of the way.